took it down. Climbed the mountain and I turned around, and I saw my reflection in the snow-covered hills, till the landslide brought me down. Oh, mirror in the sky, what is love? Can the child within my heart rise above? Can I sail through the changing ocean tides? Can I handle the seasons of my life?
Terry Lee is a survivor of suicide loss. She and her family honor the memory of their son through advocacy and the Overflow Foundation. She's a nurse and mental health first responder. Tell me what you've seen in terms of depression and suicide in the pandemic.
Okay. I appreciate your having me on, Jenny. We have definitely seen in healthcare, I'm a nurse as well as a mental health advocate since the loss of our son, and we've definitely seen an uptick in anxiety, depressive disorders, as well as substance use disorders. Um, I think in a survey done by the CDC, comparing individuals, now almost 6,000 individuals in a survey across the United States, those individuals reported, I think, in anxiety, a 3 times greater rate of anxiety or exacerbation in anxiety in compared to the same quarter of 2019. 2 times the rate of depressive disorders in the same time frame, comparing 2020 to 2019. And then as far as suicidal thoughts, those have doubled. Now, we've interestingly been trying to track whether or not there's been an actual increase in the suicide rate. And as far as Aiken County, we've not tracked an increase in the rate, nor have they so far nationally. That doesn't mean that it won't escalate, but we do know that the number of crisis calls has probably more than doubled. And those people reporting suicide ideation has greatly increased since the start of the pandemic.
You know, and so much of that has to do with just the uncertainty that we're all living with right now. I mean, who would have thought in March that we'd still be doing this in August? And
absolutely, I don't think anybody was expecting it to last this long.
What do you recommend? What sort of things are you doing to help people? And are there support groups that you recommend for folks?
Absolutely. So the main thing that Philip and I are doing, of course, Philip is a pastor and I'm a nurse and a mental health advocate. We're just trying to provide non-judgmental listening for folks. Folks across the board are experiencing greater anxiety and depression. And so one of the best things that we can do is not minimize what they're feeling. We need to be compassionate and listen to their feelings and emotions related to the pandemic and related to what they're going through. We know that the social isolation has increased those thoughts and those feelings. And so continuing to try to maintain contact, either, calling them on the phone so that they can hear a friendly voice, maintaining social contact through, social media venues or anything like that to make them feel a little bit less isolated is helpful. And I've heard of individuals also actually going and visiting at some of the nursing homes actually through the window, through a screen window. So there's still enough social distance, but they're able to decrease some of those feelings of social isolation.
It's certainly real. I mean, it is a real thing. I know I worry a lot about my mom, who's by herself up in Spartanburg. And we also see things that people do. I really love the drive-by celebrations and like the drive-by birthdays and things that we see. I think that's really a neat thing to let people know that you're not forgotten. What would you like to say, Terry, to anybody who is in crisis right now?
Well, first I'll say the National Suicide Hotline number is 1-800-273-8255 or 1-800-273-TALK. And so if you are experiencing those most severe thoughts of suicidal ideation, I want you to know that you are not alone. And I want you to hang on, reach out and get the help that you need, allow someone to be with you in whatever way they're able to. Um, Seek help because help is available. You know, many of the healthcare facilities, as well as our government agencies that provide mental health care, are continuing to provide those services. Some of them are by Zoom, some of them are by the telemedicine venues that they're able to, but services are still out there. And we know also that there's an increase in the substance use disorder area. People are reporting an increase in use or the beginning of use of some substances, Jenny, to try to help control what they are thinking and feeling in their mind related to the pandemic. And so know that you're not alone in that either. There are many recovery groups that are occurring on Zoom. I was up at the park walking the other day, and there was an AA meeting at Odell Weeks outside, socially distanced,
Wow.
but still, prioritizing that need to stay connected and to stay taking advantage of the services that are out there. So we're having to be very creative,
Yeah.
but still hyper vigilant about caring for the people who are around us. So I just say stay hyper vigilant about your own self-care and about keeping your eyes and ears open to those other people around you who may be
Okay.
suffering.
Terry Lee, that's really good advice, and I'm going to make sure that we direct our viewers to Overflow Foundation website because you have a lot of resources on that as well.
I appreciate that very much.
All right. Thank you, Terry. Take care.